Go.
Hi, welcome to the Massachusetts Health Officers Association Essential Measures Toolkit, a toolkit for addressing the local public health epidemic. On behalf of MHOA, I'd like to thank you for coming to this site to do your part in addressing the opioid epidemic. MHOA is very pleased to announce this toolkit to help local public health officials and equip them with the tools to do things in their community that they may be doing already to enhance, equip them, or engage certain types of conversations that are needed in their community. We're very happy to partner with the Education Development Center, EDC, in building this toolkit. We also want to thank the Massachusetts Department of Public Health for partial funding of this toolkit. This toolkit is also endorsed by the Coalition of Public Health, the 5 major public health organizations in Massachusetts. So what is this toolkit? This toolkit is a series of tools that you can go by step based off the 10 essentials of public health services. The toolkit has tools that not only has best practices in other communities, but also new practices and ideas for you as local public health officials to try to engage community stakeholders to plan in addressing this epidemic. We know the feds are doing their work with Congress on laws, with dealing with cartels and drug trafficking. We know the state is also doing laws and regulations and working on the prescription monitoring program. But what are we doing locally on the largest public health epidemic that we have in front of us? So when we have one death in our community, it really ripples down and affects our community. So we as local public health officials do have a part. And that's why MHOA, with our mission supporting local public health, unanimously agreed to try to build a toolkit to help local public health officials, because we know our resources are limited, our staff is limited, so we wanted to turn around and give back to our members and beyond the ability to address this epidemic and do our part in this piece of the puzzle that needs to be solved. So I want to just encourage you to use the toolkit. It's not just meant for public health alone, it's meant for anybody, your substance addiction coalitions, your community stakeholders, town administration, police, fire. Whoever's doing their part in the community can use this toolkit to try to do things that need to be done. In Massachusetts, 1 in 4 people know a loved one or an acquaintance who have died from an overdose. So this is something that really hits home to all of us, and we all need to be doing our part. So I wish you the best. I ask that you take this and make it essential in every day of your public health work. And we look forward to the good work and hearing about it. And on behalf of Massachusetts Health Officers Association, we thank you as local public health professionals for doing all that you do, because you do a lot and we appreciate it. Thank you.